I have reached 3 big milestones, which means I'm doing well with my tube and I'm ready to go home. Go on our adventure.
Ah, yeah, freezing cold here.
Good Tuesday morning, everyone. Unfortunately, I woke up with some increased pain around my feeding tube incision site this morning, but it's manageable. I got up, used the bathroom, stuff like that. Pain didn't increase too badly, so that's good. They need this room. I'm on a neuro floor, and they need this room for neuro patients, so I'm being moved up a floor to another private room that isn't going to be used by neuro patients. And if you watch the vlog where I'm admitted to the hospital, you'll remember that I unpacked my stuff all over this room, so I'm just hoping everything gets packed and the nurses help me remember everything. I don't want to lose my stuff, so we'll see. And my CT scan from yesterday looks good, so it's been confirmed that the reason I'm having excessive pain and delayed healing is from my Ehlers-Danlos syndrome, which Ehlers-Danlos syndrome does cause delayed healing, and my mast cell activation disorder can cause excessive inflammation. So between those two, that's why I'm having the excessive pain. And so I'm just waiting this morning for the tech to finish vitals on the other patients who's going to help me pack up. Then I'm moving to my new room. There isn't much to do for my EDS and mast cell except just allow my body the extra time it needs to heal. So that's why I'm being discharged with tramadol to take as needed for the pain, and obviously I'll be resting a lot. I mean, I'm getting married on Monday, but I'm not having this huge ceremony. We're just going to the courthouse, and then we're going to eat dinner with like 10 of our closest friends and family members, so that'll be fine. And oh, last night we upped my rate to my goal rate of 40 milliliters an hour for my feed, and it was a little rough, but the tramadol definitely helped. I woke up a few times throughout the night because the feed was kind of rough on me, but things are settling more this morning. Still some pain here and there because of the rate, but I think my body's finally acclimating to it, which is awesome. Found my VOG mask. It was in one of the bedside drawers, and transport is here. Wearing this to keep me safe because of my immunodeficiency as we travel through the hospital to my new room, which will be safe for immunocompromised people like me. I'm in my new room. I gotta keep the mask on until the nurse tells me it's safe to take it off, which I'm sure it is. They clean down the rooms really well before they bring me in them. And let me show you my new room. There's a bathroom over there. It's just like my old one, but facing the other way. There is a bed, but no one's gonna be laying there because of my immunodeficiency, and the protocol here is I get a private room. And there's a window, and it's a nicer view this time, and I'm just really thankful for the sunshine, so this will be nice to spend my last night in the hospital. I will miss the nurses on the other floor because I got to know them and they're so sweet, but I'm sure the nurses are nice here too. I ordered some breakfast, and I ordered a custom omelet with ham, cheese, and mushrooms, and it's actually pretty good. I usually hate eggs, but for some reason I was craving it today, and I'm just gonna have a few bites. It's pretty tasty. Alright, I have been on the phone trying to sort out home health care, and that's been lots of phone calls, lots of time on the phone, but finally got it sorted. So I'm getting discharged tomorrow around 1 p.m. and around 5 p.m. tomorrow my home health care company will be delivering my formula, which is Parative 1.3, and my feed pump, which is an infinity pump, and all of the other supplies I need for my tube feeding at home. They're also going to deliver my port care supplies, my infusion bags for my pots. We're going back to a liter of saline and a liter of lactated ringers 3 times a week, and the saline bags will be converted into banana bags. We decided since I got so much relief from those, it'll be good to keep those up and help keep my nutrients up as much as possible. So I'll be doing banana bags 3 times a week as well. And I'm hoping that my feeding pump stuff and my POTS infusion stuff all fits in that backpack I have, my infusion backpack, but we'll see. And that is all being delivered tomorrow night, and I get to go home tomorrow, and everything is sorted out. Now I'm actually gonna call the nurse and try and get up to use the restroom, but instead of using the bedside commode, I'm gonna try and actually walk all the way to the restroom on the other side of my room, which I haven't done since my surgery, but I think it's time. So fingers crossed, I can do this. Y'all, I did it. I made it to the bathroom. No feeling like I was gonna black out or anything. I mean, pain, but I had the strength to do it. I mean, now I'm exhausted from that, and the pain is pretty real right now, so I think I'm just gonna try and relax, take a nap. If the pain doesn't subside, I'll ask for another tramadol, but I'm trying to avoid them and taper off the use of tramadol, but of course I'm not gonna like make myself deal with unnecessary amounts of pain, but we'll see what happens. All right. Time to rest now. Well, I just slept for a few hours and woke up super confused because I don't remember falling asleep or anything, and I felt like I've been asleep for days. I woke up and I was like, what year is it? But I also woke up in quite a bit of pain, so I have the nurse bringing me a tramadol now. Ordered some dinner, and I'm watching Fixer Upper on HGTV, one of my favorite TV shows to watch in the hospital. I'm gonna do my best to have a few bites here, but even sitting up in bed to eat is hurting my incision site, so we'll see. Nutritionist came by and told me that at 40 milliliters an hour, I'm really only getting the minimum for my nutrition, and she'd really like to see me at 45 milliliters an hour before I go home, and to even reach 50 milliliters an hour once I'm home. So tonight we're gonna try and increase my feed again. I hit my minimum goal at 40 to be able to go home, so that's good, but she'd really like to see me at 45, and then to reach 50 when I'm home so I can get more than my minimum in order for me to gain weight. So gotta increase my feeds again, which is gonna bring some unwanted symptoms, but it's for the best. I got my medicines, did breathing treatments, I managed a few bites of dinner, and I just moved the most I have since my surgery, and I am so proud of myself. I got out of bed by myself, walked all the way to the restroom, used the bathroom. I needed help with the shower wipes and dressing and undressing, but I did a lot by myself. Then I walked all the way back to bed by myself, got into bed by myself, cleaned my tube by myself, and I was able to unhook the extension tubing and pause the feeds so I could do all of that. And so I am doing really well. I mean, there was pain, of course, but getting my mobility back, and the pain is getting more and more tolerable, so I'm really, really pleased with that. So I have to go up to 45 cc's an hour, and I know that increase is going to be really difficult on my body because going to 40 milliliters an hour was hard, and it's kind of like a little discouraging. We're going to do it at midnight tonight, but I've realized that I have reached 3 big milestones, which means I'm doing well with my tube and I'm ready to go home. 1, my mobility has increased a lot. My pain is much more manageable. I can do a lot more things independently since surgery, like getting out of bed and self-care, so that's awesome. 2, we have sorted out my home health care, and that's awesome. So home health care is set up for home delivery tomorrow. I'm not gonna have a gap in my feeds, and then they're gonna show me how to use their supplies and everything, so that's wonderful as well. And 3, I've reached the minimum for my necessary nutrition at the very least, which is 40 cc's an hour, and I'm sure I'll be able to tolerate 45 and 50 even. I just gotta work my way up to there. So at least I reached the very minimum to leave the hospital, which is 40 milliliters an hour, and those 3 milestones are awesome. Those are victories I need to celebrate. Sure, there's like a lot of things I still need to accomplish. There's still pain I need to work through. There's still recovery ahead of me. There's still a lot to learn in regards to my tube care and my life now as a tubie. But these are victories that I need to celebrate. And when you're chronically ill, you have to celebrate as much as you can, and I'm gonna celebrate the littlest victories to the biggest victories, and to me these are pretty big victories that I'm proud of. So I'm gonna focus on those positives, and a huge positive is I'm going home tomorrow. 8 days in the hospital is a pretty long time. I mean, at least for me, I'm excited to go home, be in my own bed, see Harlow, be with Judd. And the great thing is Judd is off tomorrow and Thursday. And then Thursday, Paul and Janice are coming in. So even though Judd has to work Friday, Saturday, and Sunday, Paul and Janice will be there all those days. So I'm gonna have help at all times while I'm home for my first week. Because then on Monday, our wedding day, Judd is off, and Tuesday, Judd's off again. So I'm gonna have lots of help and assistance around the house, and I'm just so thankful for my lovely support system, all the support y'all are offering, that this tool has been given to me. I noticed a lot of the comments said that I looked great in yesterday's vlog, that y'all can really tell the nutrition has already started to give me my strength back, and I can feel like myself again. I'm not fully there yet, but I'm getting there, and I'm so thankful. So anyways, just wanted to end today's vlog on a super positive note, celebrate the fact I'm hitting my milestones, acknowledge the fact I'm going home tomorrow, and tonight I'm just gonna snuggle with Ellie here and dream of going home tomorrow, seeing Judd and being excited. And that's it. Just want to say thanks to y'all again one more time for being so supportive. And that's it for tonight. At midnight, we're gonna raise my rate to 45 cc's an hour, so tomorrow morning I'll let y'all know how that goes. And that's it. Thanks for joining me on my adventure.